Hi everyone, my name is Dr. Gary Glassman. I'm the Chief Dental Officer for Dental Corp, and I'm very excited to be here with my guest, Dr. Mazen Dagher, for our second episode of Dental Talk. Today's conversation is going to be on mentoring, and as it happens, we are at the Partner Conference 2024 for Dental Corp at the Fairmont Hotel in Mount Tremblant. And actually, by the look of the surroundings in our mobile studio today, you can actually see it looks like we're in a ski lodge in the 1960s. I'm very excited to talk about this most important conversation on mentoring for our future generation of dentists, as well as our dentists who are actually thinking of transitioning into retirement, who want to find some purpose and some passion that they can enjoy the rest of their dental career. And I'm excited because I get to combine my passion for dentistry with my love for connecting with fellow dental professionals. So we're going to take a deep dive into mentoring today. So let's get this conversation started. Dr. Mazen Dagher. Dr. Dagher is the founder and chief education officer of the Dagher Institute. It's a learning center for professionals who wish to advance their skills in implant dentistry, prosthodontics, endodontics, and periodontal surgery. He's always at the forefront of his profession and regularly gets invited to various courses and conferences around the United States and in Canada. He founded the Hawkesbury Dental Center in 1999, which is a top-tier group practice. His practice is focused on implant dentistry, but also on complete functional oral rehabilitation. He's also the founder of Chapter 2 Dental, a new generation of fully interactive education platform for both patients and staff. So welcome, Dr. Dagher, to Dental Talk.
Thanks, Dr. G.
Today we're going to have a really, really exciting conversation on something that's very near and dear to my heart, and I know very dear to your heart, which is mentoring. So I want to talk about some things. I want to discuss, with you the different types of mentorship that are available to the mentee, those up-and-coming dentists that are looking for help in their future career.
Yeah, sure. There are, the way I see it, three different families or types of mentoring. Classically, you see what I call the one and done, right? I need something, I want to learn something from you. You'll invite me to your office and you'll tell me, come and shadow, come and watch a day, I'll do the same thing. I think that's very beneficial, it's to the point, but it lacks the continuation aspect. There's a second type, which is in focus groups, in study clubs. After you finish a series of lectures, you can join a study club that will continue talking about that particular subject. It is in a group and it's relatively general. I believe the third type, my favorite one, is what I call one-on-one mentorship, where you have one particular mentor that is able to follow through the mentorship with the mentee.
Interesting. So you might well call yourself a mentor concierge.
If we like, I'd like to see that. I'd like to overlook the mentorship aspect of a mentee, and to not only be the only person implicated in that mentorship. I may be the main person with the way we do it, but I might guide them to go and see you for something very specific on endodontics. But that way you'll have one person overlooking or managing the mentorship journey of the mentee.
And Dental Corp, we're very fortunate to have a network that is full of world-class specialists. Periodontics, Dr. Sam Malkinson, oral surgery, Dr. Leslie David. I'm humbly an endodontic expert. And so we have that resource that your mentees can have in addition to your expertise as well.
Absolutely.
So as far as guiding the careers of the next generation, compare when you started as a young dentist, and certainly when I started as a young dentist, being, going into a profession that's very challenging. We are, work in a very isolated environment. Often we work alone. I know when I started practice, I was in a 10 by 10 op all by myself. I had no one to ask questions to. So perhaps you can, discuss the next generation expectation of mentors and also how we can impart our knowledge on mentees.
Absolutely. When I started in 1996, unfortunately, it took me a few years to realize there's got to be a better way. I started working in various rural areas where often I found myself the only dentist in the office. So a small office setting, I'm the only dentist, I'm fresh out of school. it is quite intimidating. It's quite intimidating. You're used to being in school, to having your teachers, your professors, which are, mentors. And other colleagues are more experienced undergraduates, and all of a sudden you find yourself alone in the office setting. And I remember I had my notes that I would bring, whether about pharmacology, about surgery, about endodontic access, how to make them. And that is not the best way to go. Had to do it again, I would have seeked out and found a mentor right away. After a few years, I realized that there is a better way. So I think one of the ways we can shape the careers of young dentists is to be able to put a structure in place and invite them and let them know that they're not alone and they have a support system.
Mm-hmm. Excellent. So as far as, focusing, and I'll talk about my own personal experience. Right now I'm in the stage of my career where I think I'm at the top of my game in endodontics, but I'm at the age where I'm thinking about slowing down a little bit. I wish I had the expertise that I have now when I was, younger, 40, your age as well, but unfortunately could never get to this point without going through that period of time and learning. So I'm focusing less on my own professional growth and focusing more on the younger generation. So how has mentorship contributed to your own personal fulfillment and professional fulfillment as well?
I think that's a great question. With time, mentorship, being a mentor permits you to do the greatest thing of all, which is to transfer that knowledge you acquired over time. It permitted me to confirm also that my knowledge is valuable and people appreciate the experience that I have accumulated, and especially to see that knowledge impact them positively. So it is extremely rewarding, number one. And I often talk about it as it's my professional will. It's what I'm leaving behind, that I don't want my last 30 years to vanish in thin air. And I want to be able to relay the experience that it took me numerous decades to accumulate.
So can you just sort of describe the process of how you do mentoring? I'm a mentee, I'm coming in, I'm asking for help. You identified me as someone that could use your help. How do I get started as a mentee? What is your program philosophy?
Correct. I say look at it in two ways. If it's an associate within our office, I interact with them on a daily basis, right? So we're able to have them come and watch certain procedures, and they'll outline, say, hey, I'd like to know how to do that better. So it often comes from them. But I'm often sent external dentists. Either they get exposure to us from our courses in our institute, or Dental Corp has sent me, and I love that initiative, by the way. I have my local director that says, hey, I've got this associate that would benefit enormously from watching you work. So what we do now is say, come in and watch a day. And I'll put in different procedures, 4 or 5 family different procedures. And then often that associate, that potential mentee says, that I'd like to see more of. And that's how we begin their journey, is by identifying what interests them and what they think their area of help is required. And then after that, we literally develop a structured program for that person. Sit down with them and say, hey, if you came in once a month and a second time a month, you came in and watched me work once a month, and then you go out for 60 days and you try those things, go, by the way, take the course with Dr. Glassman, go take another course there. And then also maybe every 6 weeks, we should sit down and Zoom together so you can show me the cases that you've accomplished so I can evaluate the advancement and maybe cases that you want to set up. So there has to be structure that we put together, and that permits an actual plan to execute that everybody will follow.
And what is that plan? How do we do that? I know that you like to, have your foundation program and then your structure and then your finishing. Explain how that works.
Absolutely. I'll often address it to the mentees, whatever you're trying to accomplish, think of the end in mind.
Right. Begin with the end in mind. Now, I think you probably read the same book as me, Stephen Covey, Seven Habits of Highly Effective People.
Exactly.
All right.
That's the
Good
one.
job. Love that book.
Yeah, absolutely. And actually, I've read it twice over my career, and you go back to it and you say, yeah, that makes sense. So when you start with the end in mind, kind of like if you're building your house, is it a bungalow? Is it 2 levels? Is it modern? Is it classic? What do you want inside? And once you have a game plan, Then you structure the construction, the execution. So the same thing, especially for complex dentistry, where often they want mentorship and how do I treatment plan? How do I address complex cases? Again, start with the end in mind. And we teach them how to structure foundational work, get education on foundational work, and then the middle ground, the construction part, and the finishing part. So we kind of divided in separate steps, whether the content or the shape of it, and the amount of times we see them.
Very interesting. That's great. I like that systematic approach to your mentoring and step one,
and
step
appointments.
two.
And it's scheduled and in appointments, because if not, you never get around to do it.
Right. So it's,
I'll say every second Tuesday, you come to my office.
and that provides commitment on their behalf and commitment on your behalf.
Yep. And if they meet that commitment, then I'll give it to them. I'll be all in.
So that's awesome. So let me now, mentee's been in your program. They've been there for X amount of hours, X amount of days, maybe a year or more. How do you measure the success for that mentee?
We have to look at a few things. The main things to look at, number one, is are they improving the quality of care, right? You often talk about recognize, I took that from you, recognize what good looks like, right? Once they recognize what good looks like, what's the standard of care, they are able now to reproduce to that level and self-assess, right? And if they're not able to get to that good level, then they can ask specific questions, because now they know what the objective. Number two is obviously you can track financial, because one of the aspects is improve efficiency and improve the spectrum, the breadth of treatment that they do. So you can actually track success of the program if you see a financial impact at the end. And lastly, and as important, which is the quality of their life in the office, the interaction with the people, the reduction of stress, and the increase of confidence. They'll often tell you, I'm a lot more confident into diving into this case, and I'm not stressing about it as much. So I think these three metrics help me for sure track, is my mentorship working with that person?
So in your delivery of your mentoring, pre-pandemic, we were always in person. And then during the pandemic, there was no in-person because of the
All on
restrictions. Everything was video, e-learns, virtual, and that worked too. I mean, there was a lot of benefits about in-person and benefits about virtual. Now that we're sort of post-pandemic and restrictions have lifted, do you like to do a more hybrid approach where you take the strengths of virtual and the strengths of in-person and combine them together in a solid program?
Absolutely. I think what you mentioned, the pandemic permitted us to see that there is value into virtual. It's an asset that we can use. The hybrid approach is what I go to. There is a je ne sais quoi that you can't replace into a physical, personal contact. We were talking in the conference before, there's been studies that show when you meet a person in the physical, that you have a different reaction to them. But because of our schedule, because of distances, you don't want to not have access to the correct mentee or to the correct mentor. So you can meet the person a few times at first and supplement with virtual. Once they meet you and once you have a connection and you have the vibe going, then it makes the virtual much easier and you get best of both worlds.
Right, and you have the flexibility of seeing that person a little bit on an ad hoc basis, let's say, or they have an emergency question that they may need, and you can't always get together
Absolutely.
in the physical presence. So doing a virtual session can always be obviously very advantageous. More flexibility and more versatility as well.
Yeah, I call the virtual the support aspect and not the core. So like if they come to a course, they come an in-person mentorship, that's the core of the program. But the virtual permits to address emergencies, right? And also follow up with them, look at cases. So that combined, you get to get the best of both worlds.
Amazing. So, different learning platforms, different learning methods. AI has sort of taken the world by storm, but certainly dentistry by storm. And, we're toying around with AI, not only in our network, but in our own practice with respect to creating awareness when we look at x-rays and something that we may have missed or may not have noticed because of our busy schedules. Enables us to, now see things that, to provide a better patient experience and quality of treatment. What's the impact you feel that AI may have on the career paths of new graduates and their ongoing, CE and their ongoing training?
I think AI can be a double-edged knife. For example, for someone like yourself and myself, experienced clinicians, we understand how to use it as a supplement, but it doesn't replace our judgment, our clinical knowledge. Kind of the same thing as in surgery. If you start off in implant surgery and you only know how to place implants guided, the day that you need to rely on your clinical skills and on your anatomy knowledge, you're in trouble. So I find AI is excellent to fast track, to help the dental team to identify things, kind of tell you, hey, look at that, don't miss that. But at the bottom line, if you combine AI with the clinical experience that AI does not substitute and the clinical human judgment, again, that hybrid approach, I think will yield the best results in the future.
Yeah, and there are some negatives as well. And I know one of the negative things is, number one, it can never replace creativity, and it definitely can't replace critical thinking.
Absolutely. Critical thinking is such a point that you mentioned that is the core of our practice. We do it numerous times an hour, right? We take decisions on a evolving situation. So you may rely on AI to initially pose or help you pose a diagnosis, but as you move forward, nothing substitutes our clinical experience and our critical thinking.
Absolutely. You don't want to lose that brain power. It's important to always keep thinking with respect to treatment plans, which is often the missing link when we come out of dental school. I know for my own fact that when I was in dental school, we learned endo, we learned perio, we learned oral surgery, but no one really taught us how to put things together. Is that integral into your mentoring program?
It is one of the most foundational, and I call it take a step back and look at a comprehensive situation. The endo, the perio, the surgery are the building blocks. But again, if you don't know what you're constructing, if you don't think with the end in mind, then you don't know which materials to bring in which structure. So what I like to teach dentists, two subjects that are often not looked at in dental school and in undergrad, it's patient communication, soft skills. Those are required in order for you to excel at your clinical skills, right? And comprehensive treatment planning. I think that's something our profession need to push quite a bit, especially for the general dentist. I see them again. I make the resemblance to construction. You're the general contractor,
right?
You're the general contractor. You may send the electrical subcontractor, but he'll just do the electrical. So you'll have specialists that are at the top of their game. But remember, as a GP, you need to see the complete treatment plan of a patient to understand, where do I take him? What do I do? Where do I stop? And where is Dr. Glassman or an oral surgeon will continue. But the patient will go back to you, and you need to be the one managing the entire comprehensive treatment plan.
Interesting.
So treatment planning is and should be at the core of every mentorship program.
So as an endodontist now, I consider myself as a subcontractor, and you're the general contractor.
You're the expert contractor.
Okay, there we go. That's great. Well, you know what? I want to close things off. This has been a very interesting conversation, and we talked about this. There was something called the Whole Earth Catalog in the 1960s, 70s, probably a little later on there, and it was sort of like the Google of its time, and it was developed by a fellow named Stuart Brand. And the Whole Earth Catalog, basically, Stephen Jobs, who is one of my heroes, and he gave the 2005 commencement speech at Stanford University. And he was very interesting. At the very end of his speech, at the end of his conversation, he quoted the last page of the Whole Earth Catalog. And I know what you're going to say, because I know you read that as well. So perhaps I'll give it to you from here and let us know the impact of that statement and what it all means.
It's stay hungry, stay foolish. And I think what it means is, don't think that you know it all. Always know that you have something to learn, and always thrive and look for something to learn and look to others, because we are definitely just a little puzzle, a little piece in the pie, and we definitely don't know it all.
Amazing. That's a great way to finish off. I want to thank you for coming to the second episode on mentoring.
Thank you, Dr. Glassman.
Dr. Dagher, it's a pleasure.
Yeah.